Okay, so good morning everyone. Today we will continue with the last part of our presentation on the signs of the chest. On the signs of the chest, it will be a short part, not very long, and we will try to wrap things up, and let's hope we get benefit from it. The next sign that we will have is what called gloved finger sign. Gloved finger sign is indicates bronchial impaction. Okay, that's the bronchi filled with mucus material, impacted. Okay, like someone wearing a glove, like the fingers of someone wearing a glove. You can see it's here and here, like someone doing like that, the signs of victory. Okay, and again you can see here and here, indicating there is some. You can see also this sign, finger-like tubular opacities corresponding to the dilated mucus-filled airways. Okay? You can see this dilated mucus-filled airways. Okay? This gloved finger sign indicates bronchial impaction with mucus material, mucoid material. Okay? You can see, like in this diagram, the trachea bifurcating into right and left bronchi, and the lobar and segmental and subsegmental bronchi, and when it is impacted, it will be something like that, like the glove. Okay, here if you see it end on, it will be like circles. If you see it in face, it will be like fingers. If you see it tangential to the view, it will be like fingers. Okay, this indicates what we call gloved finger sign. Okay, you can see, for example, here in this CT scan, another sign called what we call the signet ring sign. What do we mean by signet ring? The ring, has a stone in it, making it like giving it this appearance. If you look here, if we magnify this view, you can see this is the ring and this is the diamond in it. The signet is the same appearance here. Okay, usually we see this in bronchiectatic changes. You can see here severe bronchiectasis with some mucus fluid, mucus level, air mucus material or air fluid level, whatever you like to call it, indicating cystic bronchiectasis. This is cystic bronchiectasis. Okay, so signet ring sign is an indication of what? Bronchiectasis. Exactly. You have the bronchus dilated, and adjacent to it, the diamond, the jewel, is what? The artery, the bronchial artery, that is in close contact with the bronchiole. Okay. So our next sign is what's called comet tail sign. You know the comet, when it goes into the sky, it has a long tail after it. The same appearance we can see here. There is some sort of a mass-like lesion or something here with a tail. Okay? After it, this here, it's like a tail radiating from the hilum to the mass. Okay? It's like here's the comet and here's the tail. And what does that indicate? Does anybody have any idea? The comet tail sign? Sorry? Exactly. So, there is a comet tail sign. It's swirling pattern of bronchovascular bundle which connects to the hilum, directed into the peripheral atelectatic lung, which usually adjacent to a pleural thickening of plaques and associated with round atelectasis or folded lung. Okay? That's atelectatic lung, that is a round figure, round shape, giving this tail radiating to the hilum. Okay, so when you see this round pneumonia, don't think of a tumor or malignancy or metastasis or whatever. This is around atelectasis. Okay, let's see this another example of comet tail sign. Again, you can see there's some air bully and emphysematous changes in the left lung. However, you can obviously appreciate the loss of volume on the left side when compared to the right. The left is much smaller, and this is due to some fibrotic lung changes associated with the emphysema. And you can see this mass-like lesion, which for the first instant you might think of a tumor. This could be a malignant mass. Well, if you look carefully, you'll see this tail radiating into the hilum, okay, with the presence of some sort of fibrotic hyperinflated lungs combination, okay. This will indicate around atelectasis due to the presence of comet tail sign. Okay لحد الآن؟ تمام. Good. So this is a useful sign to differentiate a tumor from other things. And you can, by the way, notice the thickened pleura adjacent to the lesion. It's usually due with some sort of pleural thickening. Okay? Now, next sign is something we call the scimitar sign, scimitar sword sign. What's a scimitar sword? You know? Scimitar. Sorry? احكي صوتك. انت احكي يلا. هلال. Okay. Scimitar هو it's like the Turkish sword. You know, this short and wide. We'll see some examples of it. So, what does that indicate, the scimitar sword? Sorry? Partial anomalous pulmonary venous return. Okay? Here, if you look carefully, you can appreciate the sword. This is the sword here. It's just beside the heart. You can see it? It's like a big, wide sword, not the tiny, pointy sword. No, it's a big one. Okay? And this is the scimitar. This is a Turkish sword. Okay? They call it scimitar. Okay? And it is exactly the shape of this part here. And with this CT reconstruction, we call it this volume rendering. Okay? You can appreciate this thing here, which has very close similarity to the scimitar. Okay? Again, another example here. You can appreciate the presence of a scimitar or something in the right side of the heart here. I don't know whether it's obvious or not on the data show. However, this is the child at 13 months old, and on the CT, what's this reconstruction? What do we call it? MIP, maximum intensity projection. On the CT coronal maximum intensity projection, you can appreciate the anomalous venous return. Okay? The congenital anomaly. لحد الآن تمام لو battery is empty and تمام good إن شاء الله. So now we have something called the juxtraphrenic peak sign, or what's called Catten sign. Okay, and what does that indicate? First, you can appreciate in this describe this chest X-ray for me. What do you think? Yalla. Okay, the patient has some rotation. First, second. So the first abnormality that got your attention is the right diaphragm? The biggest thing? Non-homogeneous, irregular, ill-defined, increased density, let's say, of both lung apices. Okay? With signs of volume loss, of fibrosis. Okay? And it contains evidence of bronchiectasis. This is bronchiectatic fibrosis. Okay? What's called cicatricial. Okay? So bilateral lung apical fibrosis / bronchiectasis with signs of volume loss that is associated with elevated diaphragm or hemidiaphragm. Okay? So, what do you think this patient have? Most of the time, most likely, most certainly, it will be a TB. So, there will be, when there is a tenting of the diaphragm at the site of insertion of the inferior pulmonary ligament, it's a sign in that indicates upper lobe volume loss. So, the abnormalities in the upper lung, in the upper lobe, the sign is in the diaphragm. So when you see the diaphragm tented, it means something wrong in the upper lobe. Okay? So if you don't remember, I will remind you just rapidly that the inferior pulmonary ligament is a double layer of pleura that connects the lower lobe of the lung to the mediastinum and the medial part of the diaphragm. Okay? It connects the lung to the diaphragm. So when there is a volume loss in the upper lobe, it will pull the diaphragm up, result in the tenting. Okay? This is the pulmonary ligament. Okay? Somewhere here, and when there is volume loss, it will tent the diaphragm. Okay? Good. Now, what's this? 3 years earlier, now the patient presented with this chest x-ray, okay? And 3 years earlier it was like this. Compare. There is obvious some sort of elevation or tenting of the left hemidiaphragm, okay? And you can appreciate some fibrosis or opacity or increased density or whatever you like it. Do you like to call it in the upper part of the left hemithorax, left lung? Okay? Again, this is a tenting of the diaphragm. Okay? And to make it more clear, you can appreciate that this is the tented diaphragm. Okay? And this is the ligament pulling it up like the tent. This some sort of tent garage, I don't know what. Yep. How to differentiate it from lower lobe collapse? Well, first of all, in the lower lobe collapse, you'll have hyperinflated upper lobe. First. Second, you'll have a triangular opacity, not tenting, in the retrocardiac part, okay? And you might have some rotation in the mediastinum, sometimes, okay?
In this case, bilateral hyperinflation or
Bilateral? This one is good. This one is, oh, usually there is some sort of volume loss, fibrosis, TB, something like that, which means combination of fibrosis and emphysema. It's always like that. Fibrosis, bronchiectasis, emphysema, things that are chronic. Upper lobe fibrosis ممكن combined with emphysematous changes, combined with the bronchiectasis, this whole thing. Okay? Now, what do we have here? We have also tenting of the right, of the left. Okay, not as prominent as the previous case, but still we have it. And you can see the interstitial fibrotic changes on the left and the right, causing this tenting appearance of the, especially more prominent in the left side. And the CT scan can obviously show you the interstitial fibrotic changes. Okay? Sure, pneumoconiosis can have some similar pattern, especially the ones that affect the upper lobes. Like what? Silicosis affects the upper lobe? Sarcoidosis has a predominance for the upper lobe also. Anyway. Okay. Good. Silicosis and sarcoidosis has the predilection for the upper lobe, while asbestosis, because it's heavy particle, goes down. Okay. Now, what about this one? You can obviously appreciate the tenting of the diaphragm In the bilateral upper and maybe middle lung zone abnormalities, which on the CT scan of the same patient, you can obviously differentiate or see that the stenting of the diaphragm is present here and the fibrotic changes and combined with hyperinflated lung, combination of both. Okay,
Like tubular release.
exactly. Elongated mediastinum. And another example here, you can easily appreciate the tenting of the diaphragm. You can appreciate the volume loss in the right upper lung zone, causing the trachea to deviate to the right side, the mediastinum to deviate to the right side. Everything is going to the right side. The left lung may be even hyperinflated as a compensation. Okay? Now, this sign is called the head cheese sign. Okay? We will talk about it. What does that mean? What does it show? What does it indicate? This has indicates a pattern of variable lung attenuation. This is what's called the head cheese. This is some kind of cheese. They sell it or like it in the western part of the hemisphere. This section shows the patchy pattern of variable lung attenuation. This pattern represents a combination of lobular areas of granular glass opacity or consolidation with normal lung. Okay? And lobular areas of reduced lung attenuation indicating mosaic perfusion. This combination of mixed abnormalities, including presence of both ground glass opacity and mosaic perfusion, resembles the appearance of head cheese. Okay? It is to a degree similar to some sort of crazy paving pattern, things like that. Anyway, when you see this appearance, this is called head cheese appearance. Okay? And what do you mean by head cheese? This thing here. I don't think. Does it look delicious? I don't know. More? Yeah, something. Yeah. Anyway, Gatling gun sign. Gatling gun sign, you can see here this appearance here, like a gun in its, the sleeve of the gun. Gatling gun. Okay, and this is indicates partial atelectasis of the right lower lobe, presents as infrahilar mass, which is the right interlobar pulmonary artery, which is reoriented and seen as an end-on mass. The airway or the segmental bronchi remains patent around the mass. So when you see this Gatling lung sign, okay, gun sign, it indicates right lower lobe collapse. You can see here there are segmental or some segments of the right lower lung lobe lost volume here and here, and this is the X-ray appearance of the lesion. Okay, and this is the Gatling gun. What do we call what's the Gatling gun? This is the Gatling gun, the one that they use to shoot people heavily. Okay, and you can see here it has multiple holes. Again here there are multiple bronchi that are still patent around the atelectatic lobe. Okay,
the hilum descended down.
yeah, sure, due to the right lower lobe collapse, it will pull the hilum down. Okay, someone asked last time about the cell sign. I don't remember who. Anyway, the thymic cell sign is another sign that's very common. We need to know it. We need to be well oriented to differentiate it from other sinister pathologies. The thymic cell sign, it is a normal finding in infancy. Okay, you can see this mass-like lesion, which represents the normal thymus in an infant. It is not a pathology, it is a normal finding. You can see this cell similar to this thymus here, and be careful when you see this. It is a normal finding in infants. Okay, older age group, no, this is abnormal. Okay, only in young age, at very young age, not only a young age. Some interesting sign to look for. This is saying, Akia is saying, come check out our stool sample. Soft stools for mom. I don't know what they're selling here. Over 60 models of stool display. It's very smelly signs. And this sign is very disorienting. Where should I go? Okay. So, with this, we will end the torture, and thank you for listening. I think we have covered a lot of signs of the chest. We just many presentations on signs of the CNS, of the brain. Maybe we'll do something else later. Just we'll see what can we do. Okay? Any questions? Good. Thank you very much.